Hospitals occupy a special place in a community. They're places of new beginnings. They're places we take our families when they're ill, places of hope. For more than 65 years, Martin Memorial has been that place for the residents of Martin and St. Lucie counties. As the communities it serves have evolved, so has Martin Memorial. When Dick Harman became Chief Operating Officer at Martin Memorial Hospital in 1975, the hospital was still small enough that a chapel had yet to be built. There were fewer doctors, fewer patients, and fewer services to offer them. A lot has changed since then. What was one hospital on the banks of the St. Lucie River has become an integrated health system with 2 hospitals, an accredited cancer center, a cardiac care center that opens in 2006, and numerous healthcare services that cover residents of Martin and St. Lucie counties. Martin Memorial now has nearly 400 physicians on staff and is the county's leading employer with 2,600 associates. It's been named one of the top 100 hospitals in the country 4 times, earning national recognition for providing the kind of excellent care our communities deserve and expect.
Over the last 29 years, I think Dick's been here. I've been here 30. It's amazing to see how a small community, one hospital has grown into a true health system that we're very proud of, especially our hallmark services of cancer care and soon to be heart care.
Much of that growth can be attributed to the vision and leadership of Dick Harman, who became president and CEO of Martin Memorial in 1989. Under his guidance, Martin Memorial has continued to expand over the years. In 1992, Martin Memorial Hospital South opened its doors. The 100-bed hospital has a recently renovated emergency department and includes a laboratory with cutting-edge technology. In 1999, the Martin Memorial Cancer Center welcomed its first patients and has been providing local residents state-of-the-art care close to home. A not-for-profit hospital, Martin Memorial has long depended on the philanthropy of our friends and neighbors. The Martin Memorial Foundation was created in 1983, raising $370,000 in its inaugural year. This year, the foundation is expected to raise approximately $6 million, a reflection of the health system's partnership with the community.
We're very fortunate to have a visionary in Dick. He's grown a small hospital into a major health systems. It's a system that serves both the financially and the racially diverse population that we have here in Martin County. And we have centers of excellence here that we can provide to our community.
With that partnership comes a responsibility for giving back to the community, something Martin Memorial and Dick Harman have done for decades. Every year, Martin Memorial donates millions of dollars of charity care to patients who cannot afford to pay for it. The health system is a sponsor of numerous charities and events designed to bring awareness to the public, ranging from fundraising walks to health fairs. During his tenure, Martin Memorial helped establish a clinic called Volunteers in Medicine to care for people who could not afford it, and has fostered numerous programs to aid residents who would otherwise have gone without basic health care needs. Through the years, Dick Harman has served on many boards of directors, including the American Heart Association, the Chamber of Commerce, the United Way, and the Visiting Nurses Association. He's a fellow with the American College of Healthcare Executives, is the past chairman of the Florida Hospital Association, and is a board member for the Voluntary Hospitals of America Florida Cooperative. And Dick is willing to do whatever it takes to support a cause. He once kissed a pig to help raise money for a youth group. But perhaps the most significant accomplishment in Dick Harman's career at Martin Memorial was the result of a protracted battle that began 20 years ago. In 1985, Martin Memorial applied for its first Certificate of Need, or CON, for an open heart surgery program. Through the years, Martin Memorial had its CON denied, approved, then reversed by the state and the courts. It fought legal skirmishes with other hospitals and worked diligently with local legislators to prove that there was a growing need for an open heart center at Martin County. Finally, in 2004, Martin Memorial got the green light. In January 2005, the health system began construction of a cardiac care center scheduled to open in August 2006. The quest for an open heart facility was a long and arduous one, but having it will save countless lives on the Treasure Coast. And it couldn't have been done without the guidance, passion, and commitment of Dick Harman.
With the population growth that we have, the medical community that we have, it just seems only natural that we should have a cardiac center here. And Dick has been one of the champions of that, getting it here. And as one who hopefully won't, but likely could need the services of that unit. I really appreciate his effort.
The same qualities Dick showed in guiding Martin Memorial to the creation of a cardiac care center were crucial when the health system faced a substantial challenge in the fall of 2004. Hurricane Francis made landfall September 5, 2004, severely damaging the medical center and outlying facilities. Damage to the elevators at the medical center crippled hospital operations for months, costing millions in repairs and lost business. To make matters worse, Hurricane Jean followed a nearly identical path as Francis, hitting the Treasure Coast once again. Martin Memorial suffered some additional damage, but thanks to lessons learned from the first storm, the health system pulled through quickly. Despite the wreckage, Martin Memorial continued to make patient care its top priority, but it also helped associates who suffered damage from the storms receive a hand as well. Martin Memorial created a disaster resource center that provided associates with financial relief, information, and other needs. Through it all, Dick was there for guidance and leadership, making decisions that got the health system back on track as quickly as possible.
People have families, people have obligations, and not everybody wants to stay in hospital during the hurricane. Then we get the families out of town. But Dick made sure we were staffed, brought the families of the physicians in and key personnel that stayed both at North and South Hospital for an extended period of time, and executed the plan again during Hurricane Jean with some refinements.
Martin Memorial has evolved tremendously in 66 years and will continue to move forward in the future. As new technologies emerge, as advances in healthcare are created, and the needs of the community change, Martin Memorial is dedicated to providing access to the very best possible care delivered with passion, pride, and a caring spirit. It is a mission that begins with Dick Harman, and through his leadership, commitment, and dedication, it is something the associates at Martin Memorial achieve every day.